now let me introduce our panelists for tonight. Um, so, the need for a new model in animal welfare is right on top of us as we speak. And the Hayes County Pet Resource Center, a HOS pilot shelter located in San Marcos, Texas, plans to trailblaze a path in implementing the model from the ground up. Newly launched, the project is already collaborating with incredible community partners and working directly with the community members themselves to learn what their specific pet support services needs are. So, without further ado, let me introduce our panel tonight, which is Lee Ann Shenefiel, who is the Hayes County Project Executive Advisor, Alex Villalobos, who is the Hayes County Chief of Staff, and Sari um, Sari M. Vatske, the President and CEO of Central Texas Food Bank, to learn more about what their combined grassroots efforts approach with data and community partnerships to garner not only community support, but also municipal support as well. So, welcome. And let me start off with can I have the panelists, each one of you, briefly introduce yourself, say hello, tell a little bit about what you do. And we can start with you, Alex.
Alex Villalobos. I am the county administrator for Hayes County. Um, my job in many aspects is, if you look at it from a city perspective, the city manager, the county administrator, so pretty much the same function, same duties within the county. I am also one of the members on the committee and the project management of our Pet Resource Education and Research Center.
Nice. All right. And sorry.
Hi, my name is Sari Vatske. I have the honor and privilege of being the president and CEO of the Central Texas Food Bank. I've been in this role almost 2 years now, moved from South Florida, where I was in food banking for 11 years there. And the Central Texas Food Bank served 21 counties in Central Texas. We are responsible for supporting over 460,000 food insecure individuals. And we are excited to share now this partnership that includes our furry friends as well. And as a personal dog rescue supporter and dog mom, we're really excited about this partnership.
Thank you. And then, and I apologize, Sari, I'm mispronouncing your name like I said I wouldn't, but Lee Ann, give us a little bit of an introduction.
Hi, everyone. My name is Lee Ann Shenefiel. I'm currently the executive advisor with Austin Pets Alive. I have 20 years of experience working in and with local government, including the last 10 years spent in animal welfare, both in executive level leadership positions at municipal shelters, including the city of Austin, as well as national animal welfare nonprofits.
All right. So let's get started with a few questions I have for tonight, because I'm really interested in talking to this group and just finding out more about the project itself. Lee Ann, could you start us off by giving us a history of how this project came to be and how you landed on the mission?
Sure. I want to acknowledge that I got to the Hayes County party a little bit late, so I can't take responsibility for this, but I can certainly talk about it. But we're here today because Hayes County leaders recognized that the regional sheltering approach that's currently delivering services to the county is not able to adequately meet the needs of a rapidly growing and expanding population. Central Texas is one of the fastest growing regions in the country. And consequently, it's challenged to meet the expectations for the level of service and to adequately address the level of need experienced by pet owners in Hayes County. So I think leaders see this as a unique opportunity to invest in the community. Pets impact many aspects of life. We know this from our own experiences, and we've already heard a little bit about that. But also there's study after study that demonstrates that pets have a positive impact on everything from our mental and physical health, to economic benefits, to increasing the feeling of community and, increasing social interactions amongst community members. One of the priorities of Hays County is community health. And so it's a significant priority. So finding and leveraging these synergies between human and animal services via this pet resource center model is a really efficient and effective investment of resources and makes the most sense.
Right. And for all of you, tell us the first major initiatives of the project. Well, one of the first major initiatives of the project was gathering insights on what the community needs were via the community value survey. And I'd love to hear your thoughts on this, Alex. Describe the community value survey, what the process was like, and what you learned, and what was important as a first step for this project.
I think it's important before we even before the community values survey was, the idea of getting information is, how do we build coalitions, coalition building in a community to really have support in a direction that's in the best interest of the county. So before that, we had an assessment, a countywide assessment by Dr. Pisano that really created an inventory of resources in our current county. Where do we go when we don't even know what the resources have, and we can only talk about them anecdotally? So we really wanted to inventory them in a very systematic way, different things that different nonprofits and for-profit organizations are doing, and then community-led initiatives that are being done throughout the county as well. The value survey, fast forward to today, really helps us identify specific needs that are sensitive to the county. And I think it's important that we ask those questions and we get that buy-in as we start to continue pushing forward and building coalitions to support a long-term programmatic plan to address the needs for the county. And I think it's important. It's a game changer in many different aspects, is that, we're not just building a facility and reverse engineering the program, is that we're building the programming first. And it's important that we get that feedback from the community on a very intentional way and in a very personal way too. So, I think that also segues into which the value surveys really identified some of the needs. And I think that's why a perfect fit in creating good initiatives is Sari is here today, because that's one of the things that comes back out of our value surveys from the community, is that, we have some deficiencies in providing food, not only for humans, but also for animals as well. And again, reiterating the idea that the human bond is very important when it comes to social services and how we address it from a community perspective, from a policy perspective, from a public health perspective, from a mental health perspective. So it's very important. So the value survey is instrumental on making sure that we're doing the right things sensitive to the needs of the county.
And Sari, as far as the value survey, I'm not sure how familiar you are with it. If you are, you can speak on it, but just piggyback in on what Alex talked about regarding, having that information regarding the community and more background and coalition building in the community. Could you speak to that?
Yeah, absolutely. If it's one thing we know about hunger, is that it's usually the result of a systemic breakdown. It is not the root cause. And another thing we know about food insecurity is that usually needs don't exist in isolation. And so if someone's in need of food assistance, they likely need housing support, transportation support. And if they're struggling to feed their human families, there might be struggle to feed their pets. And the last thing we want as an organization, and the last thing I want personally, is for any household to surrender a pet because they can no longer care for it. So anytime we have an opportunity to provide food assistance and reduce the overall household budget shortfall, whether that be feeding their families or feeding their pets, we see that as a win-win opportunity to help support our neighbors. And really, it was Hays County and Austin Pets Alive and the coalition that really did the heavy lifting. And we just helped support the distribution event on March 23rd. You know, I think we served over 250 households. I think we served 195 dogs and 135 cats. So that's really our role in it, and our belief and understanding, and why this is so important to us. The same way, you know, we want all families to stay together. That includes pets, because of, like what Lee Ann said, the value that animals bring to our lives is really indescribable.
Nice. And Leanne, did you have, go ahead, Leanne.
I did. I had something I wanted to add. I think that, you know, Alex talked about how important it was to listen to the community and sort of build the programs and resources around what the community is saying they need. And the survey is a key part of that. It gives us good, hard data. It helps us determine scope. It helps us determine priorities. But the interesting thing about this is that pet food didn't actually show up in that survey. And so it's really important that you marry that data-driven approach with community conversations so you can understand the lived experience of those who live in your community. And as Sari mentioned, the, you know, helping connect families in need with pet food is sort of this multifaceted approach. You know, one of the things that definitely showed up in our survey is the need for affordable vet care. That's a much harder problem for us to solve. Partnering with the food bank and getting pet food to folks is something much easier. And so one potential way of addressing that affordability issue with vet care is by keeping money in the household budget. But we wouldn't have gotten there without community conversations.
And I think that's what we address with research, right? You know, you have the data that comes in, and then you have to translate what that data means. And the only way you can do that is not only creating the surveys, but having one-on-one conversations with those people that are submitting those, so that you can have that qualitative aspect of, well, what does this really mean to you? And how can we help you with meeting those overall needs? And I think Leanne hit it right on the button, is that if we can save here, well, then that allows them to have more within their finance to address other issues, right? And so I think it's important. I think it's important when we're defining common goals as well in the overall community is that we take that data and really understand how we implement, coordinate, and really affect good policy that helps the overall mission. So yes, absolutely.
Well, and you know, following up on another question for you, Alex, is, you know, looking at the role of the municipality and the government in this. Talk to us about what you found moves the needle for your government and the work you do, and tell us a little bit about, I introduced you as the chief of staff, but your role in government and how you think this moves the needle, and then also um, how would a shelter get support under this plan?
Well, I think one of the things in meeting, I had this meeting you, Vincent, at one of the national conferences, and then also talking to a lot of professionals in the field and going to national conferences, learning and understanding what the needs are out there. My background is in public safety, law enforcement. I was at one time an adjunct professor at the university here locally as well. I was elected official at the city council, so on the legislative branch of that, and now currently in policy, is a complete 360 and understanding all aspects of government. Is how do we plug in initiatives into the government operational plan, and how do you do that succinctly? That way, government operations understands where to plug you in as well, when it comes to overall services and initiatives that are happening in our community. And one of the things that I saw, and I discussed with all of y'all at one point, was like, everybody's doing great things, and there's so many different needs, and we have to figure out a way to kind of coordinate and create a system that coordinates those initiatives in a way that we can also have an opportunity to look at the data and present that so that we can get funding for different types of goals and initiatives that we're trying to reform. It's also about subsistence to the organization. And one of the things I saw that was amiss for me at the national conferences was there was no real coordination on how we marry a lot of these initiatives into government. And so the opportunity there is something that I've known in the past, and leading responses from an emergency management standpoint during the pandemic. We learned a lot from the pandemic. I know a lot of people say that a lot in many different aspects, but what we learned from Hays County, in our response, we led the state. We led the state in our response because we thought outside the box, and we did what we would say a virtual response to coordination of resources. Typically during a regular disaster, you have people coming together and planning and creating an emergency operations command and addressing the issue, and everybody's working together person to person. During the pandemic, I learned that we didn't have to do that, and we can do it virtually. We could virtually respond under really critical structures under ICS, Incident Command Systems, and NIMS, the National Incident Management System. And we understood how we plugged in as a public health entity at that point, addressing a national disaster, right? And so bringing that fast forward to what we're doing today, what I didn't see in a lot of different conferences is how do we plug in? Is like we can use the ICS structure and the NIMS structure to create a virtual shelter that responds and coordinates these resources in a region. And not everybody has to be under a facility, because as you all know, all of the pros out there, it's hard to get a facility. It costs a lot of money to have a facility up front, right? And so what we've done from a virtual response standpoint is that we are building programs that are coordinated through a virtual platform, and we are proving the ground before we even get into a facility. So we're creating a transition into a facility at some point with programs and people working together. With this inventory of a countywide assessment, we've learned all the different players, all the different nonprofits, all the different service models that are out there, and we are plugging them in and creating agreements to address that need. So I think if you're looking at it from that standpoint, I think that's probably the difference in a lot of different aspects, is that we're doing it and we don't need the facility, but we're doing it, and we're fostering programs for food initiatives. We're fostering programs for fostering diversion programs for animals. We're looking at creating statewide initiatives that help us facilitate services for families and their animals, and in a way that we would have thought about this in the past. I don't think, and so I think that's critical. And Lee Ann probably has a lot to say about it, and I know Sarah has a great familiarity with ICS and NIMS and her role currently. So it lends itself. When you talk about coalition building and they all understand it, it's like, aha, we understand how to plug in now. So
yes,
I'll give it to them to talk about the details, because they're pros themselves.
No, that's perfect, and you're exactly right. You and I got into that conversation, and we both just knew, okay, man, this really clicks. This could really be like transformational for not only Hays County but for the nation as a whole. Sari, talk to us a little.
Before going on, it even lends into the idea that I don't want to miss, is that when you do it in a structure like this, it opens the doors for national and local and regional funding. Yes. Because they understand that structure. So there you go.
Yes, you already speak in their language. It's not something foreign to them that you have to explain. It's like you're an insider. It's inside baseball, as they say.
Absolutely.
Right. Sari, talk to us a little bit about that, about the coalition building, and especially from the standpoint of you being a member of the emergency response and emergency management coalitions.
Yeah, so I have a personal belief that gray skies definitely highlights breakdown under blue skies. And so that's one thing really that the pandemic highlighted, is that our way of doing things, I think we all thought during the pandemic, it's a question of, we'll just go back to the way it was before. And I think what we're all realizing is there was no before, right? There was before time, and now there's just post-COVID. And so I think that we've realized, it's cliche, but it's true, that we are better together. And I think even for us, as we see supply chain issues, as we see cost of living, as we see cost of anything, both, statewide, nationally, internationally, it makes the most sense to build coalitions and to combine resources, not only from a funding standpoint, but from an intellectual capacity standpoint and learning from each other. And so, the incident command model, the whole idea is that, there's emergency sections and each person has their core competency. And so that person that has that core competency runs that section. And so I think that's really an example of how we see emergency structure play out in this coalition, which is that we have someone that has expertise with animals. We have someone that has expertise in understanding how government works. We have expertise in feeding people. And then we also have all expertise in mobilizing. And one of the great things about nonprofits, particularly, the food bank, is that we have the ability to be nimble. We have the ability to be flexible. And we really believe that we are responding to the daily crisis needs of families. And, that's just highlighted by disasters. But the fact that, a mom doesn't know how to feed her child on a random Tuesday is no different than, a mom that can't feed her child during the pandemic. We just see those needs heightened, and there's more folks that are impacted.
This is such a beautiful conversation. I mean, like, yes, I mean, and just the way you articulated that, and you too, Alex, I mean, it just transitions so smoothly into getting direct services to people in a way that that is already happening and can happen very differently, or can happen very similarly in the future. So Leanne, listening to Sari and to Alex, and given that you have run one of the largest shelters in the country, you've done national work and with animal and now with animal welfare, and also now you are running the project from the Austin Pets Alive end. Just talk to us a little bit about how you see government involved in this process, as given that we have Alex's government, we have a nonprofit, and then also what can a government agency do from their end to be a greater part, especially an animal shelter, be a part of this process?
Yeah, I think it's already been very eloquently spoken about why sort of the coalition model and the ICS approach. I think I said that wrong, but whatever the acronym is that Alex is talking
Well,
about, it's important.
ICS, that's the acronym. That's the acronym. ICS is right.
It's okay. Like why that makes so much sense. We know that, excuse me, pet homelessness is a multifaceted issue. It's not a simple fix. There's a number of complex issues in our communities that drive that. And so I think that one of the key components of this model, which I realized we haven't actually defined in this conversation, but so our Pet Resource Center model has 3 components. It's that life-saving, focused, right-sized shelter married with robust community-facing programs that are developed thoughtfully and intentionally around the needs the community shares that they have, and increased access to resources. And so there's no way that government is going to be able to provide everything within each of those sort of 3 pillars. And so one of, I think, the roles that animal services or a government partner can play is by being the facilitator that helps bring all of this together. Like I said earlier, if we really want to talk about where this project came from, it came out of, Hays County's concern for community health. And, the recognition that community health touches both people and pets. And like, if you imagine that as a Venn diagram, that piece in the middle with the human animal bond exists. And so we spend a lot of time talking about this continuum of care, which I think has sort of been hinted at, but maybe not called that. And, what we really mean by that is that, involving and developing those partnerships and relationships with human and social services providers, whether those are government agencies or nonprofits, and animal services means that wherever somebody accesses that sort of like whatever way they enter that spectrum of need, doesn't imply that human services providers are making decisions about outcomes for pets, or animal services folks are counseling, people in a human crisis, but there's this shared recognition of the value of the human animal bond and knowledge and a organized way of making that referral to get that person and pet to what they need.
And then Vincent, yeah, just if I can piggyback off that for a minute.
Yes, of course.
I just, I think, another aspect to the role that government can play is, really kudos to Hays County for finding the need and then doing something about it. As someone that has worked for Congress and has worked in state politics, I can say that sometimes we know that government can create barriers and can create, red tape. And so I think it's really important to highlight and use Hays County as a model of a government entity that sees a need and can actually do something about it in a really positive way. I was not paid to say that, but I really do appreciate that's just another way that I think government can play a role, is just remove the barriers from nonprofits doing what nonprofits do.
It's awesome. Yeah. I mean, and I believe it was last year, I was in a conversation with the National Meals on Wheels people, and they were telling us that, they had their own, pet centric program. And it was because they were finding that, families were feeding their pets the human food, which doesn't actually address the human hunger issue.
Right.
So this coalition is so important to the community. But my question is, just talk about each of you talk a little bit about the fact that helping people with pets is basically at the heart of what we're talking about today. And how you recently had a pet food drive at the Central Texas Food Bank, and how did that partnership come into being?
Sorry, you want to talk about that?
Sure. So we held the distribution at McCormick Middle School. And really it was a conversation that I think we had with Austin Pets Alive at, a Hays County convening. So Central Texas Food Bank does a community needs assessment, and it actually was a nice piggyback onto the health assessment that the county did, because the food bank was able to focus specifically, and we currently still are, just on food insecurity. And so really it was a conversation with Susie at Austin Pets Alive saying, do you want to be part of this? I think Alex connected us as well at that meeting. And as someone who rescued an American bulldog from Austin Pets Alive, who had been at the shelter for 3.5 years, by the way, it was a no-brainer. And so, we talked about this before. I really like the idea of the continuum of care, because it can be really so difficult to navigate the system when you're in need of assistance. And it can be really hard to ask for support for anything. And so to be bounced around from one place to another, or say you have to go here, you have to go there, anytime that we can collaborate and provide a variety of resources in one place is a win for us. So that's really how it came about, was partnerships, coalitions, data, and conversations, and really just a meeting of the minds with people that have, the same goals and vision.
I think it's important that we talk about, the Central Texas Food Bank's assessment of needs for food in our county. Really, unbeknownst to them, aligns with the heat map for needs for our animals in the county. I mean, they can almost be on top of each other and almost look the same, maybe a little bit different nuance here and there. And then to have the distribution, because you got our authority on food distribution in need. Central Texas Food Bank has been a great partner to the Central Texas region for a long time, and they're shifting. Their thought process is shifting too on how they're addressing and understanding the needs for the Central Texas as well. So then this paradigm changes, and it's a perfect opportunity for building coalitions, and the fact that it's hard to push an initiative without creating some sort of visibility or a vision of how it works. So when you talk about, and I think I hear this from Lan on a regular basis, is that how do we create the best impact on these low hanging fruit that really have a ripple effect across families and animals in the region? And they're already doing it. They have the logistics expertise to move this food around. We have the knowledge to showing where the need is, and then therefore we have a very engaged community that's willing to volunteer and help distribute these things. So you're touching all the senses. You're seeing it, you're hearing it, you got people touching it, and it's engaging that specific need on a regular basis. And when you talk about coalition building, you can't take that away. People see it, feel it, they see the human contact, they see the faces on those people coming in and getting with their needs being met in a very in a very friendly and courteous way to our community as well. So I think that's really where the plug-in is. As soon as I heard what they were trying to do for the Central Texas Food Bank, what I understood from our field expert, Lee Ann, and then me facilitating the idea of this is how government works, it was a home run. I said, we got to get you guys doing this so that we can start pushing forward with other initiatives and get people to really see how this all works together under this model.
Well, and I think Alex's point about overlaying the heat map to our needs assessment underscores what I shared at the beginning of the call, which is that needs don't exist in isolation. So I think it just, further supports this idea of why collaborations and coalitions are so important.
Nice. Yeah, I mean, and the the idea and that we push at the Human Animal Support Services Project with animal shelters, and Lee Ann, you can speak to this, is that we always try to own things that we may not even be equipped or funded to do. So for instance, starting a food bank, instead of going to the food bank for a partnership, for the longest, we would try to set up our own food bank. And right, Alex? And so
yeah, absolutely.
Yeah,
I mean, you see these needs and you want to set them up because they need to be addressed, but and really because as a community you don't know what's out there that's already doing this, and it's about working smarter, not harder, right? And really building those coalitions to hit it from a broader standpoint. And then, my goodness, you can't question the idea that the Central Texas Food Bank can't do that job. They've been doing it for years. They've been a strong partner.
Yes.
I have used them, and we've been working together for disasters in Central Texas for years. The pandemic, the national freeze, Uri. I mean, there's just no question. And then for them to be open to, hey, we believe that we need to do things a little bit differently in our overall response to our region, and it just marries itself perfectly, right? You know what? That's what we were talking. We need to build another nonprofit, start doing some pet. It's like, no. We got somebody that can think outside the box and understands that these are not isolated incidents when it comes to overall need. If you've got the expertise and you have the ability and you have the willpower and understand the bigger goal in life, which is to make things better for all people, well then there it is. We can make it happen. So.
Well, and who better? You said it earlier, Alex, about funding. Who better to make the case for, especially funding where on the federal level and they pay more attention to human needs, right? Who better to make the case than Sari and her organization, or a partnership between several organizations?
Absolutely, and they're one great example in our community that's helped us through a lot of different issues. We have tons of nonprofits in our county that are helping us with microchipping, PALS, with low cost medical care with PALS and PAWS, and there's shelters all over the place. I mean, there's a coalition of entities that are doing nonprofits all over our county, and I'm meeting with them on a regular basis to kind of understand where their expertise is. I mean, we're pushing what I would say people are saying TNR. Well, we're calling it TNVR. So trap, neuter, vaccinate, and return, and changing, how, city ordinances are being met and addressing that particular issue, building coalitions to have some consistency across the county so that we're not putting ourselves in a corner to be a concierge type model. We have to support, all people in all situations. So getting that consistency from the municipalities that's going to support this as well is very important. So not only is this addressing an issue under this model of a pet resource education and research center, but it's also from a policy standpoint, is that how do we support what this mission is, from municipality, the local governments, to the county, and then also to the region, any other entity that comes in that's outside the county. Because we're having people ask, how are y'all doing that? How can we participate?
Right.
Can we come to y'all? Those types of things. And you really, we're laser focused. We got to do this first. We got to create this first and be very clear on what we're doing, clear, deliberate, and intentional on what we're doing.
And then Vincent, I think you had a question directed to Lee Ann, so feel free to come back to me for my thoughts on Raina's comment about not reinventing the wheel and duplicating services, because I have a few on those, but I don't want to skip your question to Lee Ann.
Well, from the standpoint of a government animal services facility, Lee Ann, how do you see them plugging into some of these programs rather than deciding to invent them and have them be housed inside of their shelter?
I think one of the keys to building collaboration with this project has been developing sort of a really nuanced way of talking about the animal shelter in the community. This might be an unpopular opinion, but I think a lot of times when animal shelters talk about community needs, they're actually talking about what the animal shelter needs. And so a lot of, I think, conversations around partnering with human services organizations is very much focused on, well, we need to reduce intake to the shelter. We need fewer animals. We're overwhelmed. And all of those things are true. But when you're approaching a partner like a food bank, or you're approaching a senior services organization, that kind of problem, I think, doesn't really resonate, because they're trying to solve their own issues. They're, worried about keeping, senior quality of life high, worried about, food insecurity and nutrition. And so I think that we have really sort of leaned into talking about the importance of protecting the human-animal bond to help further all of these other missions that absolutely will have an impact on the shelter that is part of this this pet resource center. It should help reduce the number of at-risk animals in the community. But a key part of this coalition has been about sort of finding sort of the commonalities in all of our missions. And so I think that's been a really important part of that. And when you do that, you also, I think, sort of naturally recognize that you don't need to own everything, that you can rely on others' expertise and resources, and create more collaborative partnerships where you're sort of envisioning where you go together versus, just telling somebody what they can do for you.
Yeah, and to that, and what I was going to say is that,
Yes.
I definitely don't believe in duplication. And what people don't realize is that, in the for-profit world, competition is actually beneficial to the consumer, right? It creates a better product, it reduces the cost of an item. But a competition in the nonprofit sector and duplicating services actually increase the cost of doing business, and it creates confusion to the end user. So that's just another example of, why we believe in coalitions and not reinventing the wheel. I like to say that I think, all roads lead through the food bank, and that's simply because everyone needs to eat. It's all something we understand. And what I've loved about food banking and has kept me in the industry personally for 13 years is the fact that if we want to serve veterans, we can. If we want to serve seniors, we can. And if we want to serve pets, we can. So I really think that this is an amazing example of how, again, what I said, core competencies can come together.
Wow, yeah, that is so beautifully said. And we often do this thought experiment, and I know I've done it with Lee Ann and Alex, of what, how if you did not have the option of having an animal shelter, then how would you still provide resource to the community? So programs like yours and partnerships are so important. All right, now let's talk a little bit. Let's go to some of the audience questions. I'm going to start with an anonymous attendee who wants to ask Alex if he can give us the political process of getting a new model for animal services in place, and how does local government do this? The second part of the question is, what barriers or advantages do they have for creating a pet resource center versus a traditional shelter, and what would he advise other governments to do to follow Hayes County? So I can prompt you with those questions, Alex. I know it was a long one, but yeah, start where you remember.
Really, the most important thing is for governments, and it's kind of hard because you can't separate. It's hard to separate that emotional feeling that you have on trying to help an animal or a person or a family address a very specific need for one of their pets. So you really have to come down to building it from the bottom line. The bottom line is, if we do this from a public health standpoint, how we will save dollars in the future, or how we are saving dollars for our families, our constituents, in many different ways. So you really have to come down to, first, create this assessment, then next, create the need and understand where those needs are. And then you have to build a model around that shows to those legislatures, for me, it would be the commissioner's court, on if we do it this specific way, and we're trying to talk about, before building a facility, building programs that really divert these family members of pets and animals to keeping them out of a shelter, so that we can reduce that the shelter portion, which saves dollars right off the bat, right? And then the diversion programs, fostering programs, all those different things. There's a lot of national information out there that really drives down the overall cost and how it saves. There's good science and good research backing the idea of TNR and TNVR for policy change. Utilize that and bring it forward, and you discuss it in a very strategic, numbers-driven, finance-led way. Therefore, you're not having to navigate the party system. You're just navigating the green system, and everybody can agree on the green system. And if you don't know what the green system is, it's money. So you have to translate and code it that way so that they understand it and understand where the opportunities are for maximizing your taxpayers' dollar and addressing the root causes, to make it better for your community, improve quality of life for their families. So, and that's very important to navigate. And what was the other question inside there?
Yes. What barriers or advantages do you have for creating a pet resource center versus a traditional shelter?
I think that in the initial part, the barrier was, do we really understand and know what resources we currently have in the area that we're trying to serve? Then it's also understanding where our true needs are, and then understanding, okay, do we have an opportunity to address those needs from a programming standpoint and a facility standpoint, right? And then educating all the people in your community on a new model, because everybody's, they get into that rote memory and want to do things over and over the same way. And sometimes I think I find myself saying this more often than not, is we have a finite amount of space. If you continue to follow the old paradigm on response to animal welfare and protection, then we are going to continue to having the same results. So we have to build it completely different. I think all of us here are talking about building it differently, more succinctly, more intentional, in that we have to educate our people to understand what we're trying to accomplish. And once they see that and they can create a vision behind it, well, then those barriers kind of melt away, and you start building coalitions and consensus to that direction. And it's been interesting is that we had a good partner with APA, and they've been very flexible in understanding what the political issues are and the policy issues are, and they've been able to navigate and really utilize a lot of their network to address the current needs, and it's visible, and people can create that vision behind it. That's the same reason why we wanted to partner with the Central Texas Food Bank. You got to create those things where people see, touch, feel, smell, and understand from a very intentional way, so that they can build that forward. So I think that's important for that. And what was it? There's one more, I believe. One more question.
The last part of the question is, what would you advise other governments to do to follow Hayes County's lead?
I think you have to identify the people within your own government, whether it's leaders inside there, officials. You got to have somebody that's on your legislative branch in part of the process. They're the ones that have the purse strings, right? They understand their constituents and have a really good understanding on where they would get support for something like that. Create a vision on what this could be and how it could help their constituents in a very strategic way for them. Once they build that vision and you show them, I think some of the influence that we had was we started some microchipping and vaccination clinics within some of our precinct offices, and they availed their offices when they saw saw the people coming in that really needed this support. That's when they knew right away, okay, this really is a need. This is not something anecdotal. It's really something necessary that needs to be done in our community, and people want this. Once they saw that vision and saw the interaction between them as an elected official and their constituents, it became a no-brainer. These are things that we have to address, right? Once you see them out there, and we have some of our officials out there helping with the food distributions, then once you get them involved and they see it and they see the faces and they have those discussions and they see the numbers and the statistics that's been gathered, it just changes minds. It just really does. You have to be that intentional. So what I would say is that, you have to do those things. You have to be creative on how you do them and engage them. And then you find those leaders as regular staff that have a passion for what they're doing, and have them help them guide the overall process when you're looking at a countywide assessment to see where your needs are and where your inventory of resources are, and then start building those coalitions with those nonprofits that can help you be successful right off the bat. And make sure that you have good people like Sari and Leanne to help back you up and show you the way to drive that data. Without them, I mean, it'd be hard for people to really visualize what we're talking about. And as you said, Sari showed you, our data aligns. There is a definite connection between the human and animal bond that we cannot deny. Period. It's on paper, statistically supported, and they're addressing it succinctly. So.
Well, and I think that, the reverse is true in terms of engaging government. If there are folks that are not as proactive as Hayes, then, they don't have an Alex. There's 200 Feeding America food banks nationally, and we cover all states, all counties, including Alaska and Puerto Rico, Hawaii. And so I would say the same way that there are animal shelters, definitely connect with the local food bank, see if they have a pet food program, and, connect with them directly. And that strong alliance, if both nonprofits go together to government and can create, the case for support, if you will, that's really powerful as well. And to Alex's point, find a staffer, right? Those are the folks that kind of push the needle, and it just takes one, dedicated staff to, move it forward. So I think you can reverse it. Is that if you feel like your government is not as proactive as Hayes, there's definitely coalitions that you can build on your own, particularly with your food bank.
Absolutely.
All right.
I think,
and
go ahead,
Leanne.
really briefly. I think the other thing that's really important is that, Hayes County has a really clearly defined goal. We talked about wanting to improve community health, but we also talked about the regional sheltering system being overwhelmed. And so there's also a tremendous desire amongst everyone to not create another overwhelmed, overfull shelter. And in order to do that, your programs, your processes, your policies, and your resources all have to be in alignment with the goal. And so part of this process is about figuring out how to bring all of those things into alignment. So someone, I think, could ask a question about resources. And so part of ensuring that we have that right-sized shelter, because we've talked a lot about the human services sort of partnership aspect, which is absolutely key. But I don't want people to lose sight of the idea that there will be animals that need to be sheltered. And so part of all of this is to not recreate a large, expensive to operate system where a lot of animals are meant to be housed together, because what we've seen is that those are burdens for communities. They're not good for pets, they're not good for the people working in that system, and they're not good for communities. And so I think another way to get started is to be really intentional about your goal, and then figuring out how, like I said, those processes, your policies, your programs, and your resources are or can be aligned.
All right. And to address one question, and we've answered it in the chat, is from Jennifer Weber, and she wanted a copy of the community value survey, the assessment. Jennifer, we do have some of the background on that in that link that is put in the chat. And so Sherry Boyette asked how to distribute community SpayNeuter for the underserved. Let me see, my question moved for a second there. For the underserved on a broader basis and public health needs that include vaccinations, heartworms prevention, and flea prevention. Do we have a quick answer to that?
I think, okay, Alex, go on.
I mean, you're probably gonna, one of the things that we've done is that we have intentionally engaged our nonprofits who specialize in those areas and provide funding to a certain degree to create a lower cost, not to create something that we would have to be in a position to supply wholeheartedly. And I think because there's different funding patterns for nonprofits and us, I think we can do a collaboration of funding that makes it a little bit more available and operational when we do disseminate that, right? That's the reason why it's important to do a complete and total assessment of your county, see where those nonprofits are, meet them where they're at, and then understand what their specialties are and where their strengths are, and then support them in that role. I think it's very important to do that. And Leanne, did you have something else?
Yeah, to add on to that, I was going to say, I think it also goes back to your goals. So if your goals are to reduce shelter intake, then it makes sense to use the data and the heat maps and things that we've already mentioned in terms of determining where the greatest amount of need is, because that's where you're going to have the greatest impact. If your goal is to do something else, like, engage a portion of your community that you've never engaged with before, then your approach might look different. But being really focused and intentional in what you're trying to accomplish and finding some alignment with your resources are key.
Nice. All right. And let me see, we have two more questions. I know we are very short on time, but is there, well, I'll start. There's a question directly for you, Leanne. How do you introduce a pet resource center model concept to a large community? Since this is something that is new for them, what do you think to begin that education?
I would be happy to chat with this person offline, because I don't actually know that I can wrap this up in 30 seconds. But I think it's really important, like I keep talking about, being really intentional and really defined in your goals. And so I think that being able to articulate to yourself what you're trying to accomplish and how you can succinctly explain that. Like we talk about our pet resource center model as having 3 key components: that life-saving, right-sized shelter, the robust community-facing programs, and increased access to community resources. And we talk about how all of those things are interrelated and, impact what happens in the shelter and impacts what happens to people and pets in the community. And so starting out at that very basic level, I think, is really important, because I think that even in the traditional sheltering model, there's a lot of confusion in the community about what the role of the shelter is and what they should expect and what happens in the shelter, and why do things happen that way. So I think that's where I would start. And also, like, start having conversations, even if you think you're not ready to. you know, one of the things that bubbled up for us is that folks were missing that there's actually a shelter component. You know, they didn't know what was going to happen to, you know, pets who were dangerous or pets for whom we couldn't find an owner. And that really helped us kind of focus and refine some of that messaging so we could address some of those misperceptions.
So just to visualize what that looks like real quick,
Mhm.
the marketing piece speaks volumes. When you talk about creating what your overall goal and defining what your direction is, and then creating content and context in a marketing plan really educates your community. The value survey does that, and then you build marketing around it. Raina's done an excellent job. APA's done an excellent job in doing that and creating that connection with the community. So they want to hear it, they see it, they identify with it, and that helps tremendously building a story.
And Sarah, and yes, go ahead, Sari.
Oh, no, I was just going to say that I know we're at time. And so I just wanted to thank my fellow panelists and collaborators for including the food bank. That was really it.
Yeah, I wanted to thank the panel tonight as well. This was an incredible discussion, and thankfully, I will. I'm close enough to this project where I will have an inside view. So I also encourage our audience to continue to follow us and the work that we're doing in Hays County. And so, thank you, panel. So much appreciated. Look forward to working with you all in the future. Also, as a reminder to our audience, our next webinar will be on May 23rd, following the Animal Care Expo, discussing practices for your mental health and animal services. And so keep an eye out in your inbox for that. And also thank you all for being here tonight. And I will see you soon. And hopefully I'll see many of you at the expo in San Antonio coming up. So thank you all and have a great evening.